Good afternoon, everybody, and welcome to the Enloe Quality Summit 2023. I am Dr. Mona Sarbu, and as the new chair of the Committee for Performance Improvement and Patient Safety at Enloe, I was given the privilege to welcome you all to the 14th Enloe Quality Summit. As most of you already know, this event is meant to review the quality of the care given at Enloe Medical Center over the past year and to recognize the efforts for quality improvement. It's the happy ending of a year of hard work, dedication, and engagement of the caregivers from all departments in our organization, and an opportunity to celebrate our achievements and set our goals for the future. The Quality Summit has become an ongoing tradition at Enloe Medical Center, and since its first edition in 2009, has continued to evolve. It all started with the realization that our care at the time had areas that did not meet the standard of expectation in the industry. A courageous and dedicated group of leaders and managers from different departments and categories of caregivers decided to come together in a meeting of the minds to find solutions to our problems. At that time, the Quality Summit was a time of brainstorming, reckoning, and troubleshooting. Their interventions worked in the most wonderful and inspiring way. The goals that we'd set for ourselves were met, and the culture of quality at Enloe was rewritten. We became energized and inspired to do better, to do well in our day-to-day work, and started to take pride in delivering the best care we could. Fast forward through years that brought all sorts of challenges and hardships, many of which will be forever forged in our memory and will become milestones in history, to today. The Quality Summit has become a time of proud celebration, and Enloe Medical Center is a respected leader in the field of quality improvement and the rightful owner of multiple awards recognizing quality and safety at national and international level. In 2023, Healthgrades has recognized Enloe Medical Center for the third year in a row with the Patient Safety Excellence Award. This is a distinction awarded to the top 10% hospitals in the country. The same Healthgrades organization has ranked Enloe Medical Center in the top 250 or 5% of the hospitals in the nation and has awarded specific recognitions and awards to programs from many departments and from many areas of care, from neurosurgery to heart disease to gastroenterology, critical care, to name just a few. The list of awards is long, and I will not read it here tonight as I would risk minimizing each one's importance and prestige by reducing it to an entry on a long list. But for anybody who wants to feel good, experience some local pride, and feel a little reassured about their health and their perspective for longevity, I warmly encourage you to check it out at enloe.org/about us. In the fall of 2022, our organization received the A ranking, which is the highest possible, for safety from the Leapfrog Group, the only hospital rating focused exclusively on safety. We have received the top grade during 13 of the 14 grading periods, which started, I think, not coincidentally, in 2009. At the end of a Joint Commission survey that took place in the fall of 2022, our pharmacist medication error prevention program was recognized as the best practice in the country. The most recent U.S. News and World Report has designated Enloe Medical Center as the best regional hospital in the Northern Sierras in multiple areas of care. I think most of us knew that we were the best, but surely nice to be recognized for it. Our recognition does not stop at the borders. This year, Enloe Medical Center received again the Plaintree Gold recertification with distinction for leadership and innovation in person-centered care by Plaintree International. And before you have a chance to wonder how many owners of such a distinction are out there in the whole world, I will tell you, only 7. And the list of distinctions and recognitions does not stop here. Here's where we are today on our journey to conquer the Quality Summit. The independent, non-for-profit medical center of Chico, California, has gone from working to meet the standards of care to setting the standards of care. What an incredible feat. This is a remarkable achievement of the talented and dedicated people from all areas of activity in our organization, of all the people who take pride in a job well done and who care. This grassroots effort to improve the well-being of our patients, and in the end, of our community, of us all, through competent, ingenious, and dedicated work, has borne fruit. And it comes as no surprise that the ideas and the work of the people in the field have generated valid solutions for improving the safety and quality of the medical care we deliver. I think in a way, this is the biggest achievement of all in the series of ongoing successes at Enloe. And is a great reason for celebration. Every year, there are more and more caregivers who engage in improvement and innovation. And this is easily seen in the increasing number of quality improvements projects undertaken. To culminate in what seems to be the most prolific year to date, in the last couple of weeks, 103 posters summarizing last year's good work and innovation that takes place at Enloe Medical Center every day have been displayed in the park for everyone interested or curious to see. They have allowed us to meet the heroes of quality care at our medical center. They come from all departments and disciplines. Some projects are small and some are big. Some span multiple areas of care, both in effort and in impact. Some are meant to improve patients' outcomes and experience, others to improve the collaboration and well-being amongst caregivers, or to improve resource utilization. But they all speak of engagement and ownership. And they are all sending the same message to our community. At Enloe, we care. Some of these projects will be recognized today with awards and special mentions. But at the end of the day, everybody would have won. We, the entire community of Chico and its surrounding neighbors, have all won. It is my pleasure now to invite in front of us one of the most dedicated, tireless, and enthusiastic champions of the Quality Summit, our Doctor-in-Chief, Marcia Nelson.
Thank you so much, Dr. Sarbu. So last year, I predicted that the best is yet to come. Well, this year, as Dr. Sarbu said, we have 103 posters showcasing our organization-wide quality improvement projects. I'm really proud of this, but not just because of the number, although it is a really great number. It's because all of this matters to me, and I believe it matters to you as well. But why? Why does it matter? Why does the Quality Summit matter? It matters because of what it says about us as individuals, as team members, as leaders, and as part of this community that cares about our place in Northern California's healthcare. Since 2009, when we started the first Quality Summit, we have become a resource for others who are seeking to develop the highest level of person-centered care. We've been recognized for excellence in areas as wide-ranging as neurosurgery, critical care medicine, to substance use disorder management. With the Quality Summit, we recognize and celebrate our achievements and memorialize our journey forward. We keep the job of improving quality top of mind because we know we'll be accountable to each other and to you. So what did it take to get here? Well, it took courage, and it takes courage to show this data, because to get to a higher level of performance, we first had to recognize that we needed to improve. We needed to do better. Every improvement journey starts with something that wasn't where we wanted it to be. To look that in the face takes courage. It took transparency. One of our organizational values is transparency. And well, it doesn't get much more transparent than this, sharing our journey with any and all who want to learn from it. And I believe it also took humility. It takes humility to say that despite all of our accolades for high quality care, we are always looking for ways to do things better and take it to the next level. We never rest on our laurels. We know that it takes daily rededication to our mission, vision, and values to continue writing this story. So we've been growing and refining this Quality Summit and the Enloe way of quality improvement for 14 years now, and it shows no signs of slowing down. That's because of what all of us together are doing and our commitment to quality and safety. A favorite quote of mine is this: "We can stand still and fall behind. We can move forward and stay even, or we can choose to lead and define the future." These words from Dr. Arthur Dugoni, the Dean Emeritus of the UOP Dugoni School of Dentistry, are as true today as they were when I first brought them up in 2009. Our charge, your charge, is to choose to lead and define and to continue building the bright future we want for ourselves and for our patients. So let's look at some ways that Enloe caregivers rose the bar for quality this year. Now, if you remember 2009 when we started this, I used to give a little summary of every single poster. That was about 25 posters, and it was a lot easier to do. I promise you I won't do all 103, but I wanted to just share with you some of my favorites. So many of you know that we're getting ready to build a new Enloe Regional Cancer Center. But what you might not know is that one of our new patient and family advisory councils is working with Enloe caregivers to co-design this project from the bottom up and create a truly person-centered experience. And at our urgent care clinic, Prompt Care, they changed how patients are assigned to providers, and in just 3 months, they saw a 50% decrease in the number of patients leaving because of a long wait time. And as part of our ongoing commitment to really fighting substance use disorder and trying to minimize deaths from overdoses, the opioid overdose treatment naloxone is now given free of charge to people by just coming to the ED and asking for that. One of my favorite posters was a really heartwarming story about how case management worked tirelessly to help a stroke patient travel to his home abroad and safely recover with family in India, navigating legal and financial hurdles to provide the care this patient needed, and most importantly, what he wanted. And so if you want to see a publication-worthy poster, something that should be in a journal, not just up behind me on the Quality Summit, check out the Antimicrobial Stewardship Program's description of how they used multiple interventions over several years to achieve appropriate use of a very specific, powerful antibiotic called aztreonam. They found that using an electronic clinical decision tool that incorporated a practice-changing evidence was the most successful intervention and decreased aztreonam use by 90%. What that means is that it was 90% more appropriate to use this antibiotic. And then the cardiovascular unit, they demonstrated that there's a direct line between strong teams and patient experience. They focused on creating a unified culture, a culture of unity, and they were able to improve patient satisfaction on their unit from 73% to 89%. And then our hospitalists. I cannot say enough about our hospitalists. They are really some of the rock stars of our hospital. And they decided to take on the very complex multidisciplinary process of timely patient discharge. This is way harder than it sounds. They were able to improve the percentage of discharge orders written by 11 o'clock in the morning from 35% in 2021 up to 43% in 2022. And that was able to let us have increased bed availability to admit our patients. It shortened the length of stay, and it improved patient satisfaction. On our Mother and Baby Care Center, now they use something called transcutaneous bilirubin monitoring. They can just put something on the baby's head or other body part and find out how high the bilirubin level is. What that's been able to do is reduce the number of pokes for these little tiny babies in their heels to check the bilirubin levels by 25%. And then our marketing and communications team, they're not just marketing and communication, they are caregivers also. They play an important role in providing person-centered care. So they updated our website. And after they updated our website with an eye towards ease of navigation, they saw 6% more users, 10% more page views, and increased searches within the user-focused website. They're getting the word out about all that we have to offer here. And then building community ties. That's one of the things that I think that we have really been doing the best at these past few years, and it really makes us special here. Through a partnership between Enloe and the Jesus Center, homeless people who need additional time to heal after a hospital discharge can receive services to safely transition out of their acute care stay. That's good for all of us in the community. And then finally, at the Enloe Rehabilitation Center, bedside rounding has improved teamwork and patient safety, resulting in 66% fewer falls overall and no falls occurring during change of shift. That's really remarkable. And what about wellness? 10% of this year's posters highlighted projects that improve the wellness and the well-being of our caregivers. That is real person-centered care. So, many of you know this is my last Quality Summit. It's been a great ride. It's been quite a journey. I am beyond proud to have been participating in this. And before I turn the role over to the eminently capable Dr. Sean Myrano, I have just one simple request for all of you. Always be on the lookout for a great poster that you can support and celebrate. And when you see that poster, say, that would be a great poster. And so now I'd like to invite Mike Wilchermuth, Enloe CEO, and the Chief of Staff, Dr. James Moore, up in front to present this year's Quality Summit Award.
Well, one of the drawbacks between being third on the agenda is that there's a high probability that everybody's already said what you planned on saying. I'm not quite to the point where I remember to bring my reading glasses everywhere, so I may not be able to read this anyway, but we're going to deviate slightly from the agenda. It's easy to see that this annual celebration of our organization-wide improvement efforts has developed deep roots. The collective energy behind our Quality Summit is almost, if not completely, self-sustaining. The summit itself, as Dr. Sarbu so eloquently stated, is a major factor, a foundational factor in our quality of culture. But it wasn't always that way. Our original summit in 2009, as Dr. Sarbu said, was born of a number of brainstorming sessions, starting with Dr. Marcy Nelson, Pete Magnuson, and others, I believe. The original concept being that of a science fair, marked by a handful of hardy souls working with trifold cardboard and hand gluing carefully cut construction paper to manufacture our first submissions. Despite a less than enthusiastic response in some years, the Quality Summit has continued to grow as we all increasingly recognize the importance of periodically taking stock of our accomplishments and celebrating our successes. Through it all, Dr. Nelson has championed the cause with collegiate gusto, almost single-handedly nurturing this infant program into full-fledged adolescence at age 14. Now, from the original summit of 39 posters, we see well over 100. And we fully expect this event to grow to adulthood, never to retire, the continual beneficiary of the foundation Dr. Nelson, with some help, has laid.
Thanks, Mike. So I'm Dr. James Moore. I'm an emergency department physician here, as well as fortunate to be the chief of staff of the medical staff here. I've been asked to say a few nice things about Dr. Nelson here, which was so hard to come up with. Clearly, hearing her speak, and many of you who have heard her speaking at this before, the intensity and passion she has for this is so obvious. It doesn't take much to have to explain beyond what you can see with your own eyes here, right? When I started 10 years ago, this was still very early on, third or fourth year, and I remember that the quality posters were more of a top-down kind of, not a mandate, but the ideas kind of came from the top and said, hey, what do you think? What do you think? And I tell you, it has grown so organically into something where ideas are now coming from secretaries and techs and janitors, and anyone with patient contact with any kind of good idea is bringing it up, and next thing you know, there's this beautiful poster behind us. It's been such a cool change to see in the culture, and I think it really reflects what we have here at Enloe, in that physicians can work with anybody in the hospital to make it happen. So particularly from the physician side, I want to say thank you for increasing that level of engagement, because even over my time here, I've seen that grown exponentially. And I think you know that. And if you don't, you're hearing it from me. So, you know, it's more than just having an idea, though. And I think what's been really powerful is that you've been able to take ideas and you've been the conduit from ideas to action, and then from action to results. And that's what matters, because an idea is nothing if there's no results behind it, right? So thank you for that. Moving forward, we are all very sad that you're leaving. Can't really put into words what a loss it is for the institution. I think I speak for all of us when I hope that you will not just disappear. So, in order to help guarantee that, by spirit or body, we have to come up with some way to make sure you're still on the hook, basically. So, in discussion with senior team, the board of trustees, as well as the medical staff leadership, it was unanimously decided that from henceforth, the Quality Summit Award will be known as the Dr. Marcia Nelson Quality Summit Award. Please come up.
Thank you so much.
And I wonder if you would be interested
Oh,
in presenting
Oh.
your namesake award.
my name's, of course. What, oh, it's even the right one. Oh,
That's why we had to keep it hidden.
oh, okay.
It has her name on the award.
It has 2023. Well, thank you. I am beyond words. And this is my legacy project. This is my legacy project. We are, it's all because of us. So thank you. I'm speechless. So anyway, without further ado, I am so pleased and proud to give this year's 2023, I guess I have to say it, Marcia Nelson, MD Quality Summit Award, to the team with a large, complicated title and the most words of any poster, but really amazing. And it's the appropriate use of S-Trianam project from our antimicrobial stewardship program. And so I'd like to invite them up to receive the award. There you go.
Thank you much. Check that out. All right. Well, it's nice to be recognized, and it's nice to be in the presence of friends and colleagues. Tip my hat to the board members, physicians, administrators, and all support personnel. It's very gratifying to be recognized in this regard. This is Travis Anderson. He's done all the heavy lifting. I've been more in the kind of the background mentor role. And in terms of optimizing S-Trianam use, it was how to use it wisely, and that doesn't necessarily mean using it more. I'm going to get into the weeds a little bit, talking about beta-lactams, and I use that term to describe penicillins and cephalosporins. This project grew out of our PenFast project, which was instituted to try to get a little more insight in terms of what a penicillin allergy really meant. And frequently, it didn't mean much at all. And I'll get, this wind is really wonderful because it's like rolling thunder. And I want you to know that it all started with Dr. Nelson. Anyhow, the clarification of beta-lactam allergies has evolved over the last 2 decades. Increasingly, penicillin and cephalosporin allergies have been found to be unique to the side chains of the beta-lactam rings, and there will be no test after this. Prior to this insight, cross-reactivity amongst beta-lactams had been considered near universal. That is, if you were allergic to one penicillin or one cephalosporin, that whole class was not going to be used. Today, it's widely appreciated, however, that 90% of beta-lactam allergies are flawed. In fact, when I take an allergy history, the vast majority of beta-lactam allergies are vague, nonspecific, or attributed to childhood viral exanthems. I mentioned PenFast, which is a kind of educational tool for physicians and nurses that was implemented as a teaching tool to risk stratify use of beta-lactams in patients with a history of beta-lactam allergies. A common risk mitigation strategy amongst prescribers has been to eliminate, as I mentioned, entirely the use of all beta-lactams for any patient with an allergy to penicillin and cephalosporin. Enter aztreonam. It's a monobactam, so vaguely structurally similar to beta-lactams, was found to have absolutely no cross-reactivities with beta-lactams and was widely prescribed as a result. Don't really have to think about it. Penicillin, cephalosporin allergy, use aztreonam, no allergies need to be considered. Unfortunately, aztreonam has 2 distinct flaws. It has a spectrum of activity similar to gentamicin, that is, it only covers gram-negative rods, and it doesn't do that very well anymore. It is a 35-year-old agent. And the cost of aztreonam is about 40 times higher than gentamicin, which has the same spectrum of activity. Attempts to seek alternatives to prescribing aztreonam were largely unsuccessful until a pivotal study was published and reviewed by us, and that's where the real thinking started. Dr. Anderson will take it from here.
Thank you, everyone. For those of you who don't know me, my name is Travis Anderson. I'm a clinical pharmacist and co-chair of the Antimicrobial Stewardship with Dr. Courtney here. First, I just want to say congratulations to Dr. Marcia Nelson. That's an amazing award. And from a quality perspective of everybody at this institution, we are definitely in gratitude and of all of your efforts to bring this to Enloe. So another round of applause for Dr. Nelson. Second, I just wanted to say real quick, thank you to all of the departments that put posters together. I think it's a true testament to the work that we do as a collaboration. And I took the time to read all 100 posters. It really is a testament, again, to everybody's strong work and our ability to work together. So I just want to say thank you to all the departments that put posters together, plus it gave me better competition. So picking up where Dr. Courtney left off in terms of our poster, really we worked through a multitude of pathways, really trying to educate physicians, getting the word out. Ultimately, we use the power of Epic, our electronic healthcare record system, to put some clinical nudges in. And then there was this amazing journal article that came out of, believe it or not, it was the emergency physicians, which I don't even know I wouldn't even know the emergency physicians would know what aztreonam was, but they put a really good paper together for us. And unfortunately, not everything in medicine is always touchy-feely, right? So the paper was actually associated with increased mortality when using aztreonam as a beta-lactam avoidance option. So with education, multiple rounds of education, clinical nudges and using the power of our electronic medical EHR system, we were able to put in some nudges and some help to the physicians to kind of curb what we would consider as questionable prescribing. Really what we wanted to do is drive physicians to the more appropriate antibiotics. So that was a great thing. I'm happy to say that to this day, we're still looking at data. The changes that we implemented are still moving forward. We still are seeing more appropriate antibiotic prescribing using our primary agents, as Dr. Courtney said, and we're seeing still a reduction in inappropriate or less favorable antibiotics as well. So this ASP project is really unique in a couple ways. It highlights the most important aspects of medicine from my perspective. One is first is embracing change. So the constant thing that I can depend upon as a clinical pharmacist is change. That's the one thing I promise you will happen is change in medicine. Evaluating new literature, implementing new treatment guidelines, as well as educating the healthcare team on these changes. Second, this project highlights another excellent part of Enloe, and that's that we work as a team. An idea from one individual, which has already been said, can be fostered by leadership, worked on by committees, and implemented for everyone within the organization. This project highlights the value of collaboration between frontline healthcare team, the IT clinical, IT pharmacy, and informatics team. Using all of this collaboration and using Epic has provided us with endless opportunities to transform patient care using data collection, clinical tips, treatment algorithms, and sometimes even warnings. So the speed at which medical literature is getting published has increased exponentially. ASP is looking forward to many future projects utilizing cutting-edge diagnostic technology, clinical nudges, and using the power of our electronic healthcare record. So thanks for having me. Hopefully that was okay. I'm not sure who's next.
What a wonderful evening of celebration and recognition. Before the curtain finally falls on this year's ceremony, I want to congratulate the winners of the Quality Summit Award, Dr. Nelson Quality Summit Award, Travis Anderson, Dr. Brian Courtney, and all the people who have contributed to this project. The result of their work is a fine example of how like-minded people, driven by the concern for the present and future well-being of our patients, driven by the concern for the present and future well-being of our patients, come together and find solutions even before problems arise. It makes all of us feel better, safer, to know that there are people amongst us, dedicated and competent, constantly watching out and doing the right things for the right reasons. And if in our turn, we all do the same in our area of expertise, the culture of quality improvement will carry on. I want to personally thank all the caregivers who have invested their talent, expertise, time and effort in the projects of improvement in the past year. I want to thank our marketing department for the titanic work they put together to print all these beautiful posters. I want to thank all of our leaders in thought and in action, from the Enloe board members to the administrative leaders, physician and nursing leaders, and the leaders in all area and at all levels of work at Enloe. By fear of inadvertently omitting someone, and in the interest of time, I will not call names, but I hope you know when you are the special recipient of my thankful thoughts. I want to thank the founding mothers and fathers of the Quality Summit and all those who have carried these initiatives on their broad shoulders since the beginning. All of those who will continue to carry it further, and not the least, the ones who are planning to retire from the active work of quality improvement. From here on, all of us here today will be able to say that we have had the privilege to work alongside Dr. Marcia Nelson, whose optimism, professionalism, and endless passion for improvement and wellness will continue to inspire us and oblige us to deliver our best work. Dr. Nelson, with your example in mind, we pledge to preserve and further the legacy of competent and compassionate caregiving, and we promise to remember to celebrate our successes and recognize our heroes along the way. The work of quality improvement at Enloe Medical Center is far from being done. There are many things that still need improvement. I dare say that most of us, if we take a moment to reflect on it, know of things that can be better, and even have an idea or two of how to make these things better. With all my heart, I ask you, please, join the never-ending effort to be better at what we do, and work to build a culture of competent, wholesome, and heartfelt care at the Enloe Medical Center. This culture of excellence is going to benefit all of us and result in improved health and healthcare experience for our community and increased job satisfaction for all the caregivers. And now, to paraphrase a slogan of a popular retail company, I'm going to say, never stop improving. Never stop caring. The Quality Summit is an elusive one that keeps moving higher and higher the more we climb towards it. And now, let us celebrate.